injectable treatments at Mapperley Park Clinic are carried out by Dr. Helen Fernandez, who has 16 years of experience. First of all, we're going to look at the injection of botulinum toxin for relaxing muscles. Having put the client in sitting so that she can check the natural fall of the face, the doctor gets the clients to frown so she can actually check the placement and the strength of the muscles. Botulinum toxin needs to be injected into the muscle directly, through the skin, so at right angles to the skin. Again, we're checking the muscle, how strong it is, and we're injecting just a little bit into the muscle itself. This enables the doctor to get the dosage and the placement right. So once more, she's doing a big frown, wrinkling up her nose, and that's that part done. We're looking now at lateral eyes. These are what some people call crow's feet. We prefer to call them laughter lines. And 3 or 4 little injections here are all you need. It's pretty painless, you barely even feel it, and that just relaxes those little lines there. We're going to look at filler in lips now using Juvederm, which does contain anaesthetic, but we can use anaesthetic cream as well. You'll notice that the doctor's injecting well to the side of the lips at first, and she's putting a little bit in the upper and the lower lip, and then you'll notice that she goes around to the other side of the client and injects that side. The reason for doing this is to allow the anaesthetic to start to work, so that when she works her way towards the middle, it's much less uncomfortable. At the moment we're doing what's called the lip line, or the vermilion border, and now she's filling in the centre of the lip, so this increases the fullness of the lip. You can either just raise the border, or you can increase the fullness of the lip according to what the client wants, or what suits the natural shape of their lips and is appropriate obviously to their age. We don't do big lips at Mapperley Park. We do very natural looking lips. So we're just filling in the central part of the lower lip, and there we are, done. We're going to look at dermal fillers in cheeks now, and we're using Radiesse. This is to increase the volume and what's called the OG curve. Here we're putting 3 deposits along the cheekbone, and then the doctor comes in and injects a lovely little comma-shaped little deposit of filler that lifts as well as shapes the cheekbone, giving that nice little Angelina Jolie effect. Again, we monitor it according to the age and the natural face shape, and we'll raise one cheek, and then the doctor will go around the other side and do the other cheek, and then obviously we match it up and make sure everything's perfect and matching. It's quite a quick procedure. We can put anaesthetic cream on first if we need to, but we have anaesthetic in the filler. It's not a particularly painful treatment, and it takes minutes. Very simple, very easy, not painful, but just gives a lovely effect. You can see the slight swelling there, but there's a definite raise in the cheeks. We're going to look at something a little bit unusual now, which is dermal filler in hands. Hands really do tend to show your age. They go quite thin and crepey, and this is a way of actually injecting filler without creating much bruising or side effects. We don't use cream. The doctor is basically raising up the skin, lifting it away from the major veins underneath, and injecting a little bit of local anaesthetic in a bolus or a little bobble. Through that bolus, she's now putting a little bit of the actual filler, which is white when you first inject it and becomes clear later. She can see exactly where it is. She just moulds it to exactly where she wants it. It's as simple as that. You push it into the spaces and it fills up those little dips and really plumps up the hands. The client puts a glove on and sits on a hand while we do the other side. It's as easy as that. At the end of the treatment, although the hands look slightly swollen, you do get a really good indication of just how plumped up and more youthful they're going to look. If you would like to have your treatment carried out by experts, call the Mapperley Park Clinic today on 0115 969 2323.